and joining me today to help separate the fact from the COVID-19 fiction are Millennium's Chief Medical Officer and practicing physician Alejandro Perez-Trepichio, also a physician leader of Millennium's 550 healthcare practitioners, Dr. Usha Chandrahasa, who is an immunologist, clinical immunologist and allergist, physician, and a founder of the Center for Respiratory Excellence and founder of the Charlotte County COVID-19 Task Force. And via Zoom from Jacksonville is Dr. Alpa Patel. She is an internal medicine physician practicing who's been involved in the research behind the COVID-19 vaccine trials. And I welcome all of you today. Thank you for joining us. And I know that you are very excited to be able to dispel some of the myths there for our patients. So let's start out with a few comments from each of you regarding the current state of COVID-19. Again, all of you are practicing physicians. Dr. Perez, what is it, Dr. Perez-Trepichio, what is it that you're seeing in your patients?
Well, certainly one of the things that is more noticeable is the increase in cases that we've seen in 2020, now 2021. And on the clinical practice, on a day-to-day basis, we're significantly increasing the number of patients that come to the office and they turn out to be positive.
Right. And Dr. Chandrahasa, you as co-founder of the COVID-19 task force in Charlotte County, you started with other colleagues in Charlotte County this task force because you were noticing that this disease was taking a grip of the area and the patients, and you guys banded together to try and get the latest research and be able to serve the patients in this way. What is it that you're seeing in your practice?
So very interesting compared to how we were back in 2020 April till now. This pandemic is just taking a lot of toll on our physicians, but we have not lost track. The track is to keep our patients healthy and our community healthy. And yes, we're seeing a surge right now of our patients with COVID-19, younger patients, patients that are not vaccinated. That's who we're seeing right now in the hospitals. And vaccination is so essentially important at this time.
And they're also sicker patients, I understand, too,
They are
than
very
the first
sick.
wave.
Yes.
Dr. Patel, you're involved in the research with the COVID-19 vaccines. What is it that you're seeing in that area of your clinical involvement?
So we've done a recent study here locally with the Pfizer booster study, and we found that yes, some immunity does decrease after 6 to 8 months. They have found through some of this data, though, that an additional dose does boost the immune response by about 5 times more, even against this Delta variant in those patients under age 55, and up to 11 times more in those patients over 55. So we still are encouraging everybody to get vaccinated. That's how we're going to get ahead of this. Here locally, unfortunately, I think our county, Duval County, has been the #1 this past week as far as COVID hospitalizations, and it's very frustrating and upsetting to see this. We're constantly being getting phone calls from patients and family members who are COVID positive, and I think a lot of our other patients who have other illnesses are actually being affected too. I've had a patient this past week who had a GI bleed that didn't go to the hospital because they were just scared. And I think we have to try to get a handle on this by getting ahead of the curve with vaccinating.
Okay, and it's a shame that that's the kind of reaction that we're getting, but that's why we're here to try and dispel some of the myths. And with the August 13th announcement by the CDC that those who are moderately to severely immunocompromised should be getting that booster, what kind of questions, rather, are you fielding from patients, Dr. Perez?
Well, certainly in terms of the booster vaccine is who is eligible. At the beginning, most of our patients, they want to know, am I eligible at this time? That's one of the first questions that we get. And if not, then when will I be eligible to get my next shot?
So your patients are interested. Here at Millennium, it was our mission initially to vaccinate our most vulnerable patients, and we were able to do that. Dr. Chandrahasa, if you could explain a little bit about the immunology portion of this booster shot.
Sure. As an immunologist, my patients are immune compromised. These are patients who have a primary immune deficiency. Obviously, they come as the criteria for this third booster, but also patients who are immune suppressed on medications is very important.
And Dr. Patel, what are you seeing as far as in your research, right? I think you're also trying to determine when a booster could be available for the general public, are you not?
Right. And I think, in the original studies, they did not have immunocompromised patients as part of the studies. However, they have noticed that patients that are immunocompromised that have thus received the vaccines afterwards, they don't develop the same antibody response with a two-dose series. And that's why their original vaccine series is now recommended to be a three-dose series. We are finding that the boosters are helping. They're helping even with this Delta variant in clinical studies, and so I think there will be a push to consider boosters for everyone that's going to be past 8 months. We hope that this data is going to be looked at over the next month or so, and that recommendation being made at that point.
Okay. We look forward to, what comes out of your research, clearly. Another topic, hot topic, unfortunately, is this of the vaccine hesitancy. There's so much misinformation out there. What are some of the top questions or perhaps incorrect or misinformed kind of things that you're hearing, Dr. Perez, and from your patients or the general public?
Yeah, certainly this is very detrimental to what we want to accomplish, right? So there is the issues that we have heard so far in terms of affecting your DNA or causing long-term effects, or that this has now been studied with sufficient timing, and then what are the long-term side effects of the vaccine. All of these things that are conspiring against getting ourselves and our peers and the entire community vaccinated. Without that, we are going to continue in this pandemic for a long time. So it's unfortunate that a lot of people are paying attention to not the correct source of information. I mean, at the end of the day, what we want is to get the information and form our own impression, but from the right source.
Right, right. And Dr. Chandrahasa, as an immunologist, are you hearing perhaps some erroneous information from your patients who are the most vulnerable?
Of course, of course. Unfortunately, there's a lot of misinformation out there, and we try to encourage the right information. Patients think that they can get COVID from this vaccine, and that's not true, obviously. We know that now. We know that there are so much benefits from vaccines. Patients are misinformed about fertility issues and that they shouldn't get it while they're pregnant. And I really encourage women to talk to their OBGYNs, and the OBGYN societies are really encouraging vaccines for young people with appropriate age, obviously, and during pregnancy as well, because it's detrimental for the pregnant women if they did develop COVID.
Right, right, really scary. Dr. Patel, what, we've heard that of the mRNA vaccines that some people are concerned because they were developed so quickly. What would you say to that concern?
Sure. I mean, the mRNA platform wasn't totally new. It was new to vaccines. That platform's been used in oncology. I think patients do have a concern that this came out so quickly, and that is one of the things I hear, that it still isn't FDA approved. I mean, hopefully we will have one or two of these approved FDA-wise pretty soon. They just sometimes need more data. But the reason why the vaccines came out so quickly was because they were done on a large population. Like normal vaccine studies can last 4 or 5 years, and they may have like 5,000 patients in them, whereas there was 50,000 patients included in these studies. So there was a lot more data to look at. It was also done during a surge like we have right now, And so the prevalence of disease was high at the time too. And then the other reason why they were able to get them out so quickly too was that, vaccine doses were being produced and made at the same time that the studies were being done. And, companies and the government took that risk in waiting for the data. So that way, as soon as these things could be approved, they were readily available right away.
And to be clear, when you say that risk, you mean that they were having the doses being produced, which generally in the research phase of a vaccine is not advised, of course, because that vaccine is not proven. So that could cause a loss of money for the manufacturer or whoever is paying for the vaccine.
Absolutely. Yes, yes, that's the risk we're talking about.
Right, right. Okay, so in Florida, about nearly 62% of those 18 and older are vaccinated, but still, Florida, very multicultural state. I'm sure that, Dr. Perez, you've talked about hearing concerns from different ethnicities about the vaccine.
Of course, and certainly in different groups, there are different concerns in terms of what will be the implications, and their cultural and religious concerns as well. All well taken and understood. This is not exclusive of COVID, but certainly now is playing a significant role in terms of achieving the levels of vaccination, which we all have heard in terms of herd immunity, right?
Right. Any cultural concerns you've heard? I'm
Yes.
glad to see the multicultural panel that we have here,
Yes.
and that a benefit of that is that we get to find out more about what different ethnicities are saying or concerned about.
Sure, there is concern about vaccinations and religious issues that people have brought to our attention, but it's really knowing the knowledge. They're scared that there's fetal material in the vaccines, and that's where the concerns are brought into us. But really having an open conversation with patients really makes them understand that this vaccine is really more of a high-tech vaccine, and we really are very proud to have such a vaccine available to us in the United States. Messenger RNAs are vaccines. Not every country has this, and we're really lucky to have this type of technology and be able to use this in this pandemic.
Right. Dr. Patel, doing the research, can you explain to us briefly in layman's terms how the messenger RNA vaccine works?
Yeah, so messenger RNA is, when you go back to high school biology, an intermediate step between using your DNA to create a protein. Messenger RNA is a set of instructions to your body to make a specific protein. So messenger RNA never even enters the nucleus of the cell. It does not alter your DNA, which is a misconception. It only stays in the cytoplasm. And it's very short-lived. Once it's given your body these instructions to create a specific protein, in this case, the spike protein that's on the virus, it degrades very quickly. And once that spike protein's made, your body hopefully recognizes that as foreign and creates this antibody response that we're talking about.
Yeah, I've done reports on some oncological pharmaceuticals that work in this way, and they were in fact very, very effective. On now to the treatments. As we know, the state of Florida is making monoclonal antibody therapy available to those who need it. Could you explain, Dr. Chandrahasa, the immunology behind how that works?
Sure. We're seeing this wonderful response in neutralizing antibodies, basically, when you get COVID-19. And if you follow the criteria for it, it's an outpatient type of management that we're giving in the hospital settings. They're available in multiple counties. There is a website, obviously, that the patient can go to. They do have to get an order from a physician to get the antibody, but these are neutralizing antibodies, monoclonal antibodies for COVID-19.
Are you getting requests, Dr. Perez, from any patients for this treatment?
Certainly, that has been something that as the monoclonal antibodies treatment started, and we should be very clear, this is the one treatment that has been proven highly effective, and there is in two settings, right? So in terms of the outpatient setting, and then in the hospital setting treatment type of thing. So we're talking about the outpatient type of treatment, and this is very important. There is a limited amount of time that we have to be effective. And I think the deployment of these rapid response or strike teams that are going to help us bring these to the community is extremely important. But this should not be the reason why we don't get vaccinated, because we have treatments, but we don't want to get there in order to get vaccinated. Vaccines still rule, and this is we're very lucky to have treatments that have been developed to that effect.
Prevention always best. Dr. Patel, any experience with your patients and requesting this type of treatment?
Yeah, absolutely. I mean, since we've had quite a surge here in Jacksonville, we've actually probably 10 of our practices patients received these antibodies this past week. It's indicated now, actually, even for patients over 18 that meet certain risk criteria, which can include anywhere from overweight to obesity, kidney disease, immunosuppression, multiple other diagnoses that actually qualify them. They have to be treated within the first 10 days of symptoms, and they can't already be on oxygen or be deteriorating. So this is something we want to do early on, not waiting late to do it. And I think here in Jacksonville, we have pretty much all of the hospital groups that are doing the infusions, but even through the state, they've set up a site at the Jacksonville Main Public Library where patients are able to self-refer themselves. So if they just have a positive test result, they don't need the doctor's orders. The Surgeon General has actually signed emergency orders for patients to be able to go there, and patients are able to register and schedule themselves through a website that's called patientportalfl.com, and they just have to show proof of the positive test result to be able to get it at that state-run site.
But nevertheless, like most things in medicine, prevention, right, is always preferred.
Absolutely.
So, any other concerns that you as again practicing physicians are seeing from your patients that we could maybe share with the audience? Which again, our audience will be our patients for this. So, anything else that they could benefit from hearing?
Perhaps one of the things that come to mind is, okay, some of the questions that we get is like, Doc, I suffer from COVID. Why should I get vaccinated? The notion that having had COVID is going to protect you and you do not need the vaccine is something we need to emphasize that is not the case.
Right. Dr. Chandrahasa, as the immunologist, have you heard people saying, I've had COVID, I'm sure I have great antibodies,
Yes.
Could you explain the difference between whatever antibody someone might have from having had COVID to what a vaccine could do?
Correct. So if this question is brought up quite often in the office and when I meet patients, they are under the impression that once you have COVID, you cannot get COVID again. And unfortunately, that's not true. Yes, you may develop antibodies if you get severe disease. Not everybody who develops COVID may actually produce adequate antibodies after COVID infection. These antibodies may not be sustained and protect you towards different variants that we're being exposed to now. There's a difference. Vaccines do help us, and we're seeing that the patients that are coming into the hospital are really unvaccinated patients. The vaccinated patients are very little amount of patients are coming into the hospital. They may have other coexisting conditions as immune suppression. But really getting the vaccine helps to boost your immune response, but also helps to produce protection, sustained protection through different mechanisms other than antibody production. And so that's very important, and that's why this vaccine hopefully will continue to be successful for us.
Right. Dr. Patel, in your research, anything else you could add to score the difference between any potential, protection you would have from having had COVID against that of a vaccine?
Sure. Even in measuring antibody titers, which, we don't recommend routinely doing, but in the studies, obviously they were getting these things drawn. So we do know that between patients that got COVID, their antibody titers are sometimes a lot lower than the ones that have had the vaccinations. And so it's kind of like, sending in an army of antibodies when you get the vaccine versus maybe just a few people to fight this off. I mean, that's the difference between natural versus vaccine-mediated antibody response. And it's not always the antibodies that are the most important. I mean, patients then develop what we call T-cell mediated immunity, where it actually, there's other cells that are recruited too in fighting this off. And sometimes you don't produce that significant of a response with natural infection, especially if you had a milder case.
Okay. And we get this question a lot from, anywhere I think that we go is when will this pandemic end? And, there are, for the most part, four different scenarios, and that is no vaccine, no mitigating factors like the mask, like the hand washing, then all the way over to doing it all, right? Everybody reaching that herd immunity, using the mitigating factors, which of course would be the best scenario. How do you get your patients to understand that fact, Dr. Patel?
I mean, I think, all of it together works the best. I mean, definitely the most important is getting vaccinated. We have proved evidence that vaccines do reduce risk for death and hospitalization, even though we are seeing a little bit of an uptick in cases or what we call breakthrough cases in vaccinated patients. They usually are not getting admitted. They're not dying from it unless, they have certain other significant comorbidities. The hand washing, the masking, the distancing, all of it together can make a huge impact. And I mean, and we get it, everybody's tired. We're going into a full second year of this, but I think if together, we do this for each other and band together, we can hopefully, prevent more variants from forming, which is what we're dealing with now, because we only have half of the population vaccinated. And so the virus, the more it spreads, the more it will continue to mutate. And, if it becomes a mutation where we can escape even the vaccines, that's what we're afraid of. So I think the push still is please, please get vaccinated.
Certainly, certainly. I was just taking a few of our patient questions. I think this is a good one for you, Dr. Patel. This is Matt from Estero asking, why aren't the vaccines FDA approved?
Well, the vaccines are still under EUA because they were gathering data to see,
When you say EUA,
sometimes it takes a
emergency
year.
authorization.
Emergency use authorization, yes, and that's because they were still trying to gather like a year's worth of data. Sometimes is what the FDA looks at when they have vaccinations coming out, and that wasn't available initially. But because of the millions of doses now that are given, that's gathered a lot more data in general. And it appears that the FDA will probably be looking at this sooner, probably in the next month or so, to analyze that data and give it full authorization.
Okay, well, maybe that will allay some fears out there regarding vaccine hesitancy. Dr. Chandrahasa, I've got one, Val from Venice asking, I have a pre-existing condition. I don't know how my body will respond to the vaccine. What would you say to that?
Most people with pre-existing conditions do fine with these vaccines. It really depends on talking to their doctor and really addressing the pre-existing conditions. Are these pre-existing conditions really stable? That's the most important thing.
Right.
But most people with complex immune disease have done fine with the vaccines, and we're hoping that everybody will continue to get vaccinated.
Great, great. Here's another one from Fort Myers. I think we've already talked about this, women's fertility or affecting the menstrual cycle. Dr. Chandrahasa, you said to just
talk to the GYNs about this. They have a lot of literature that's available to their patients. They really need to openly discuss this, and most of the societies are really recommending vaccines.
Certainly, certainly. Also, this one, we've gotten this one quite a few times, Dr. Perez. I've been vaccinated, I'm not feeling well, but I don't need to be tested.
Right. That's extremely important. Anytime that you have symptoms that are compatible with COVID, as we know it today, it's very important that we do test. Testing is one of the fundamental parts of understanding what is circulating in the community. So testing, it helps us understand what is happening. It's measuring the temperature of what is going on. So when you have symptoms, consult with your healthcare team and let them know what your symptoms are. They will make the right assessment and then direct you to safely be tested. So testing is very, very important in this. It's one more of the tools that we need to continue to use as we did before. So that got us to a very good place, and now we have a variant thrown into the mix. So we need to continue to make the best effort possible to end this or curtail it.
Right, right. And Dr. Chandrahasa, well, you're a specialist, so what can you share with us as far as your practice goes with any of your patients who may be affected by the virus? Is there anything, because these are immunocompromised patients, they're some of our most vulnerable patients. Anything that someone who may not be immunocompromised can glean from your experience?
My patients who have immune deficiency rely on their immunologist really as their source of information. And they really want to learn the right way because they have had really complex disease their whole life. And so when a disease like COVID-19 happened, they really approached us and they approached me to get information. And the more information we have, the more education we have, the stronger we are to make decisions and to get vaccinated. And they were on par with getting the vaccine. They were waiting for the vaccine. We talked about the disease process. We talked about what types of vaccines were coming out way before the vaccines were out to get patients vaccinated. They were right on board because they know that if they didn't have this tool, they may not continue to have life on Earth.
Right, right. Well, let's end out the discussion, right, with looking at the horizon. Dr. Patel doing the research on the vaccines. What does, the general population have to look forward to coming out of your research and hopefully, as we, again, turn the next corner in this pandemic?
I mean, hopefully this is something that will improve with time. I mean, additional boosters we're finding right now are needed to help with the variants because there's so much change in the variant structure, so that additional antibodies helps target more areas so you can overcome the disease. We may actually be doing some actual variant vaccine studies soon in the next 6 months or so. So, look forward to something like that. Because right now the boosters are really just an additional dose of the current vaccination, but there may be changes coming up in the next 6 months to a year as this progresses. Please believe in the science and the scientists. We are working hard in trying to alter things as fast as can be possible.
Well, thank you, and thank you very much for your research, Dr. Alpa Patel. We'll certainly be looking forward to what your research continues to uncover. And Dr. Chandrahasa, founder of the COVID-19 task force in Charlotte County. I mean, you got together with your colleagues because at the beginning of this pandemic, you knew that there was a need to come together with your colleagues, with your fellow scientists, with your fellow physicians. How do you feel now as far as everything that you've been able to accomplish and learn with those groups of physicians and care teams in Charlotte County?
We continue to learn.
Right.
That's what's interesting. We continue to learn. We continue to work together. And that's really why I think in our county we've done really well. My physicians in the hospital, hospitalists, pulmonologists, are working so hard and they're keeping up with everything. And they're always wanting to learn and wanting to make this disease process something that we understand and we're able to manage. It's really important that we really work together, outpatient as well as inpatient. Our goal is to really not let the patients get sick enough to go to the hospital getting vaccinated. It's very, very important. I cannot stress that enough because my colleagues in the hospital are getting very tired, and we really need to vaccinate, and we need to help this situation.
All do our part.
Yes.
And it must be exciting, though, to be able to add to the body of evidence and knowledge something like a pandemic, which I'm not sure if any of us ever thought that we'd be experiencing this in our lifetimes, and you all as doctors and scientists.
It's true. I mean, we read about it, right? We know a pandemic could happen, but we thought it was theoretical. We never thought we would be living in this pandemic and really dealing with it and learning and evolving and really working together. That's the most important thing here, working together and helping our patients understand the disease process and understanding the significance of getting a vaccine.
And here we are, each of you lending a hand to that. Dr. Perez, you help lead 550 physicians, nurse practitioners, physician assistants, putting out that information, interpreting that information with the help of your team here. Anything that you want to add about where we've come and where we have yet to go?
Certainly, this has been a very troubling time, but we also have to rescue what we have learned of each other and our communities. The most important thing is whatever we can do to help you, to educate, to appease those feelings that there is a problem. The most important thing is, if you didn't get vaccinated, please do so, not only for you, but for those who can't.
Right.
And the other aspect is how can we continue to help the community for things that may be coming. And more importantly, we talk about the pandemic. One thing that we need to also emphasize is the other chronic diseases, diabetes, hypertension, all the other things continue to happen, unfortunately.
Right.
So that is another part that we have to link. We do know that what is a significant problem for us in the hospitals being filled with COVID patients is because now all the chronic diseases are now being treated. So think about the implications of what we do, washing your hands, social distancing, masking, getting vaccinated, also have implications beyond what we are talking about. We say COVID is very important, but there's a lot of other things that we need to still take care of.
And as you mentioned, these chronic conditions, those of our patients who do have them, very important to keep them controlled and be in the best condition you can be, because if you do come across some kind of bug or virus, to be in the best possible position.
Correct.
Right. Thank you very much for your knowledge and sharing your time with us. I know that our patients really do appreciate your expertise and your insights. Of course, you can always go to millenniumphysician.com for all the latest COVID-19 news, vaccine information from our experts and more. But we'll continue in the meantime to monitor the latest updates and bring you those insights told through our experts. We've made it a mission to inform you of what's going on. And with that, we'll be wrapping things up now and leave you with important websites, phone numbers, resources where you can go to get that correct information. Thanks for trusting us with your health. Here, Millennium Physician Group, always your connection to a healthier life.